Welcome back to Weekly Fix. This week we are going to go through elbow pain. There are different types of elbow pain. You kind of have golfer's elbow, tennis elbow, CrossFit elbow, surfer's elbow. Whatever type of activity you do, there's typically some sort of elbow injury associated with it. A lot of times, any of these elbow injuries are overuse injuries. They come from a lot of excessive gripping, whether that's holding onto a surfboard, whether that's hitting with a racket, or whether that's just overall gripping things too much. A lot of times you'll notice that you'll start to lose some grip strength. You'll start actually having pain in either inside or outside of the elbow as you start to move or start to grip things. So basically what's happening is the little tendon that's up here that's connecting these muscles to the bone is getting aggravated. When it gets pissed off, it starts to cause a lot of pain, especially point tenderness where you can actually get right up over the bone. Pretty painful through there. And even as you work down, you can probably get a little tender into those tendons, and then the muscles should feel a little tight. Muscle tendon junction are kind of like a spring. If you look at the tendons, they're kind of like a rope. They kind of anchor both ends. They don't really move a whole lot. They can kind of add a little tension, take away a little bit of tension, but not too much. If you look at the muscle, it's kind of like a spring. It can contract, it can relax, it can have passive tension going through it as well. So if the muscle especially gets really tight passively, you're gonna start to put a lot of tension through those tendons, which then kind of keep this pain cycle rolling. That's gonna make everything hurt for longer and worse, which is one of those things that you really need to take care of elbows quickly. Once they start to linger and start to get pissed off, they typically start to wander either from outside to the inside, inside to the outside, even back into the tricep. It's one of those things that you don't really want to get into this chronic elbow pain issue. It's really hard to get rid of. It takes a long time. It's really hard to tell somebody not to use their hand. It's hand and overall gripping. Again, all of those muscles, you can kind of see if you move those fingers, all those muscles are coming up into here. So it's very grip linked that a lot of these elbow issues are coming from. So be careful while you are doing things with grip, whether that is grabbing onto a surfboard again, either turtle, duck diving, vortex, you can definitely put a lot of stress in here. Any of the CrossFit things where you're actually holding onto a bar, holding onto a pull-up bar, that's going to put a lot of stress through those elbow tendons, which can lead to getting them aggravated. So, how do you get better? We're going to go through a couple techniques to try and help out. First one is just nice and easy, taking a golf ball. We're just going to do a little bit of soft tissue massage, just trying to get into those muscles, get a little blood flow, get them to kind of loosen up a little bit, take a little pressure off those tendons. When you're rolling, I want you to stick through the meaty parts, okay? Once you start going up into the tendon and you start digging up here, it can make things worse. You're pushing on something that's aggravated. It's kind of like poking a bruise. The bruise isn't really going to get better if you keep poking at it. So if it's painful up here at the elbow, don't roll out at the elbow a lot. Try and roll out through these meaty parts that are in the forearm, whether that's the front of the forearm, that back side of the forearm. Depending on where you have your hot spot. If it's going to be on the outside of the elbow, you want to kind of roll that back part of the forearm. If it's more on the inside of the elbow, you want to really make sure and get that kind of front part of the forearm through there. But nice and easy, you can go side to side, you can go up and down. There's no real wrong way to use the golf ball, and other than going through that tendon. Don't go through the tendon, don't go over the tendon. If it hurts too much, stop. It shouldn't be aggravating anything. From there, favorite thing for elbows is going to be Voodoo Band. Voodoo Band is one of those great tools that's going to get a nice flush and kind of push all the crap that's stuck in there out, as well as we're going to get an active release of all of the tissue. So, doing this on your own, there's two ways to start it. You can either grab it in the hand and start the wrap, or you can do a little lay down. You're going to use your arm and body to kind of form a nice little way to get it going. So, nice big pull. With this stretch, you're looking for about 70%, maybe a little bit more. You can really see that band actually deform as it comes up and across. across, and pull, up and across, pull. It does take a little while to get good at this. It's okay if the band starts to kind of flow away from you or kind of roll on the ground. That's all right. It takes a couple times before you can kind of get good at moving kind of elbow in, using it as your second arm. Once you start to get up higher on the elbow, you can kind of crank it down a little bit more, and then lay the other part of the band down, and then just a little tuck in. So from here, it's okay for a hand to kind of be a little weird where you kind of move it and it just kind of does its own thing. But big thing with movement is we want to move through full range. Both sides, there you go, hand down, palm facing out, elbow's gonna bend, same thing with the wrist. We're moving both directions all the way through, hitting all those little angles. You can even add a little bit of rotation in with the elbow. We're just really trying to get everything flushed out and have that nice push. As far as total on time, you can go anywhere from about 30 seconds to a minute. Once you start really building up your tolerance, you can definitely go a little bit further where you're closer to that 2-minute mark. But it's a really good indicator. You should see some of those little lines if you're doing it tight enough for maybe 30 minutes to an hour afterwards. They're not going to be this defined, but you should still be able to look down and kind of see that they're still there. Next option that we're going to go through is scrapers. These have become very popular lately. They work very well on the elbow as well, but you have to use them correctly. So I highly recommend actually getting a tool that is used for this. The big difference is there's going to be this beveled edge, so you're going to have this kind of plow effect that's actually going to guide the tissue to get in as opposed to actually using a butter knife. There's a lot of really good options that are out there, anywhere from plastic to metal, and having all these different curves and everything. So from here, all we're going to do is nice and easy, just add a little stroke. You're not putting much pressure on the way back up, a little bit of light pressure on the way down. We're not trying to go super deep. We're not trying to dig into that muscle system. We're trying to get into that myofascial system that's going to be right in between those two different layers of skin and muscle. That's going to be where all that fascia is. So we're not going super deep. We're going a little bit light, having that nice little push. And with this one, you can kind of go up over those tendons a little bit because you're not really digging in. It shouldn't be super painful. So just nice and easy, just rolling through there. And then you can also go the other way where you're working both directions of the tissue. Depending on the one you get, you can also work all these little different angles. Big goal is though, don't go too deep. It should be nice and light. It shouldn't be super painful. You shouldn't see a whole lot of bruising from this. We're not trying to create an uncontrolled injury. We're trying to just get this to feel a little bit better, get a lot of blood flow, get those myofascial layers. We're also trying to stimulate some receptors that are in there that are going to help take the pressure off of those muscles and get them to relax a little bit. Okay? So another really good option. Again, it works really well for elbows. I highly recommend that you do get one, even if it's a plastic one off of Amazon. It can really benefit elbows if you use it correctly. Last thing, tape. Tape does not work on everything, and it's not necessarily going to fix this. The big thing and the big goal with the tape is it's going to help take the edge off, and it's going to try and keep those changes that we made with all of our treatment. So, just tearing off a little strip. I'm going to say that I have some outside elbow pain. Focal point is right here. I'm going to anchor this just right above. Nice and easy. From there, just a little pull. And then I'm just going to lay this down. I'm not really applying a big stretch with this. At least with this tape, this is rock tape. It does not require a whole lot of stretching. It has some inherent stretch built into the tape already. And then from there, we're just going to rub it a little bit. We're just going to try and heat it up. That heat is going to activate the adhesive in there. It's going to get it to stick a little bit better. So you'll find that you might also feel just a little better already once you have that anchored on. The other option is that you can do a cross grip. This one's a little harder to do on your own. If you're going to do it on your own, you can kind of tear both sides, get a nice little anchor, From here, I'm gonna go bicep and across. And then we're gonna take off that middle part. Try and give a nice amount of stretch to it. So with this anchor, we're trying to go closer to like 80% stretch of the tape. We're actually trying to put it on a nice big stretch. Right over that tender spot. And then again, rubbing it down just to try and make sure it stays. It's definitely a lot easier if you have somebody that can stretch it for you and put it on. But if you don't, having those two different sections that you can kind of peel off, stick, peel off, it's very good. Again, it can help take the edge off. Rock tape, I really like it because you can leave it on anywhere 3 to 5 days, maybe even last 7, depending on the amount of activity that you're doing and the conditions that you put it on in. Definitely rub the skin if you have any loose oils to make sure that it stays a little bit better, but it's a very good option. Hope this video helped out. If you have any elbow pain, have any elbow issues, try these out. It will help get you back to where you want to be.